You are watching the Doctalk show.
Welcome back. Before we went for the break, we listened to a survivor of HIV, Mr. Justice, telling us that you can live with HIV and still live a normal life as long as you take your antiretroviral treatment. So I want to know from our team of experts, the HIV experts, how far we have gone as a country in terms of fighting the HIV. Could the disease burden be increasing? Could it be worsening? Or are we seeing some remarkable progress since the virus was first discovered? So I'll start with you, Dr. Fiona. What's the picture like in terms of the progress in HIV? Are we seeing more cases of people suffering from the disease? Are more people dying? What's it like in the research world?
Yeah, so incredible progress has been made over the last 3 decades. So in the 80s and 90s in Uganda, about 18% of the adult population were HIV positive, and that has reduced now down to 5.7%. So that's through a combination of sort of treatment and prevention. So I think that's something Uganda can be incredibly proud of.
So we've come from 18%.
18%.
That was like of the whole population, nearly 18% people had HIV.
Exactly.
Now the current thing is at how much?
5.7%.
7. So definitely a definite reduction in the number of cases.
Absolutely.
Okay.
HIV is a lifelong infection, and so there's 50,000 new cases of HIV still in Uganda every year. And so the actual total number of people living with HIV is increasing year by year. And people are surviving longer, which of course is great. Absolutely. But yeah, that means more and more people requiring HIV care. So it's excellent that antiretroviral therapy has become simpler as time has gone on. Now it can be as simple as one pill once a day. And hopefully with new models of care, it will be possible to access antiretroviral therapy even in more and more rural kind of locations, and without having to travel long distances, etc., to get to clinics.
So Mr. John Kasbante, there's 50,000 new cases each year is a worrying statistic. What is contributing to this? Is it that people are now lazy, they're no longer fearful of HIV? What are we not doing right? Why should we have 50,000 new cases occurring each year?
Yeah, I can just tell you that new HIV infections are as a result of things people know and things people don't know. But the greatest problem is as a result of things people don't know. Mm-hmm. We know that many people are initiated onto ART treatment. They start their ARVs, they take them very well, then they stop. Mm-hmm. But then the problem are those people who don't know. We having a target of 90, meaning that we want to get as a country to a level whereby 90% of the people with HIV get to know that they're actually HIV positive, 90% are on treatment, and 90% have viral suppression, okay, just like Mr. Justice is.
So where do we stand?
So as we stand currently, only 84% of the people who have HIV are actually aware of their HIV status. Okay. 88% are on treatment and only 87% are immunosuppressed, meaning that there are plenty of people around there who don't know their HIV status. And we can attribute this to the reasons as to why we could be having a rising number of people having HIV. Okay. To
but
these new infections.
From the sound of it, doesn't sound so bad. We are close to the target at some point.
Being closer to the target doesn't mean that you're hitting the target. That's one of the challenges that we have to face as people in the fight of HIV. It takes everyone to fight HIV. That's why if everyone went on and did an HIV test and they discovered what their serostatus was, for those who are meant to be on treatment, they start treatment. We shall achieve we shall even hit beyond the 90 goals to be 100% goals. Okay. And I think with that we shall be able to control this epidemic. Otherwise, by 2025, we shall be counting in 250,000 plus number of new infections.
But I think people might be curious, why does it have to be 90, Dr. Fiona? Why do we hear this 90, 90, 90? Does it mean if we reach 90%, there will no longer be HIV in Uganda? Is that what it means, this 90, 90?
Yeah, so the 90, 90, 90 targets are set out by UNAIDS, and it gives countries worldwide something to work towards. And if we hit those targets, then transmission of HIV should be reduced. However, it will take much more than that for HIV ever to be eliminated, and we're still waiting for things like vaccines and cures, but those things are still several decades away. So at the moment, the most key thing is to prevent HIV infection by trying to reach these 90, 90, 90 targets. And an enormous amount of effort and international coordinated funding is helping us to try and meet those targets. But if we take our foot off the gas and become more relaxed about it, we could easily find we're back in the days of the 80s and 90s where the rates of HIV can be like 1 in 5 of the population again. So we really have to keep the pace going and keep fighting sort of this epidemic by trying to hit those targets and then go beyond those targets.
I'm sure people know about HIV. They know how it's transmitted, who is at risk, if you unprotected sex or sharing shops can predispose people to HIV. So what is the latest in the research regarding HIV?
So there's a lot of progress in the field of HIV prevention, which is really exciting. So one of the sort of hottest things is around pre-exposure prophylaxis. So this is when somebody who's HIV negative takes an HIV medicine daily by a tablet, and it can prevent them getting HIV. So people who tend to take this up are people who are at risk of HIV, so maybe adolescents, young people, sex workers, key populations, including sort of fisher folk or men who have sex with men. So it's a way of preventing yourself from acquiring HIV by taking a daily tablet.
And how would it work? Because if someone is negative, how would it prevent them from getting HIV?
Yeah, so it's called a sort of a prophylaxis, which means by having the HIV drug in your body, if your body was to become exposed to HIV, the drug would stop the virus from entering and replicating. So it's a highly effective way of stopping yourself from getting HIV if you're somebody who is at risk through your lifestyle practices.
Is it available to can anyone access it, and where can they access this PrEP?
Yeah, so it is being increasingly rolled out throughout Uganda. At the moment, some of the programs are focusing on key populations like sex workers, adolescents, people in discordant couple.
People at higher risk of getting the HIV?
Exactly.
Okay.
Exactly. So it is if you think that you are at risk of HIV and that you could benefit from PrEP, then it is available. So it's worth trying to access PrEP services to protect yourself.
Is it a dangerous drug? People may be worried if I'm negative and I'm taking ARVs. Won't I get some very crazy side effects, that can interfere with their daily life?
Yes, so the drugs we normally use for PrEP, pre-exposure prophylaxis, is basically TDF and lamivudine. These drugs are very safe, and their side effect profile is almost nothing. Mm-hmm. So they are very safe drugs to use, and we don't expect any side effects while using them. Okay.
Are they the same drugs used in what they call now PEP? Because there are two items, there's PrEP and there's PEP. So what's the difference in those two?
So PrEP is a pre-exposure prophylaxis, meaning that you take it before you get exposed to the virus. Mm-hmm. PEP is post-exposure prophylaxis, meaning that you take it after you're exposed to the virus. Mm. So basically, all the drugs we use are still the same because they are all aimed at preventing the virus from multiplying in the body. So what we normally do is, for PrEP, we shall use TDF and 3TC, that is tenofovir and lamivudine. And in PEP, we use TDF, 3TC, efavirenz, or dolutegravir.
So you kind of increase the drugs in the post-exposure
prophylaxis. Post-exposure, because you're already exposed to the virus.
Okay, so after the break, we'll come back to talk more about prevention and prevention of HIV. If you have any questions or comments, and you can post them on our social media platforms. We'll be right back after the break.
You are watching the Doctalk Show.